I think it's hormones. You do a hormone test and they're fine. Well, this can be brain autoimmunity. You have anxiety for no reason. You have depression for no reason. Or sometimes situational depression and anxiety is exacerbated. It's much worse than it should be. Again, these are things we want to look at. This can be an autoimmune reactivity. Stage 3 is the autoimmune disease itself. You're positive with antibodies, you're positive for the labs, you have severe dysfunction, and you have tons of tissue loss. Just like you stated, this is the time where now you have a diagnosed disease. But you also have 40 to 60% loss of tissue. So can you imagine if you have horrible brain dysfunction and you lost 40 to 60% of your nerves, and now they can call you an autoimmune brain? Does that make sense that we should look for it here? That's what the standard medical community is looking at. You got to have all the criteria to meet that autoimmune disease. That diagnosis is right here. That's just not going to work for me here. Okay. So now this is how this whole dysregulation starts. We have pollutants. We have toxins, both in our food and the air and in our environment. You have hormone imbalances. You have food allergies. You have infections. A lot of times we'll have things like H. pylori in our gut. We'll have acidic guts and acid reflux for a long time before we figure out we've got a chronic infection that's not healing. Or you have a tooth abscess. Or you have some sort of infection that goes ongoing, a virus of some sort, and it dysregulates your immune system. And the last one is stress. Emotional stress or chronic emotional stress can also dysregulate the immune system. And what happens with this is this immune dysregulation means that you start losing self-tolerance. Self-tolerance means that your immune system knows the difference between you and what's foreign to your body. Self and non-self. Does that make sense? When the immune system becomes confused because of any one or all of these stressors, that begins the process. And what happens, here's a good for instance with this. Say you love pizza, and you eat pizza almost every night. But you have a lot of stress. And that stress gives you a leaky gut or poor bowel function, right? Now you start breaking up the bowel lining, and you start absorbing, not digesting your proteins from that pizza very well. And those proteins get absorbed undigested. Your immune system looks at that and goes, wow, I'm attacking that. It looks like a virus to me because it's a protein. And it attacks. Now you develop a food allergy to, say, wheat or even dairy. When that occurs, and it keeps occurring, you have more immune dysregulation. Your immune system looks at that as saying, hey, that looks just like my thyroid. Well, I'm going to attack the thyroid because I think it might be a virus. Does that make sense? This is the process that starts. Now, these are very common. I can't tell you how common this is. Especially in my practice, I see a ton of this. And if it's not being addressed, you're not addressing real important issues in health. So when this becomes real apparent, you develop the self-tissue antibodies. Antibodies against your own tissue. And your immune system attacks your own tissue. We have 3 parts. It either goes to silent autoimmunity, which this can even be in your genetics. Like if mom, say, has a thyroid problem or a celiac problem, all the kids should be checked. Or they could have silent autoimmunity. So kids will oftentimes test positive for the antibodies. They have absolutely no symptoms whatsoever. But is it good to find that? Is it good to screen it? Heck yeah, it is. It's very important. If it's already gone to autoimmune reactivity, then it's already taking its course. And of course, if it has all the criteria and the damaged tissue, it becomes an autoimmune disease. This is going to get old really quick here, bending down, changing this all the time. So again, I keep alluding to this. There's an explosion of autoimmune disease. It's worldwide, too. It's not just exclusive for the United States. 1 out of every 12 men and 1 out of every 9 women have an autoimmune disease. Don't you think there's a lot of people? Mm-hmm. That's disease. That's not silent autoimmunity and reactivity. That's a lot of people. Women, sorry, you're 10 times more likely to have, say, a thyroiditis than men. For the systemic lupus, you're 9 times more likely to get it than men. Sjogren's, And the primary biliary cirrhosis, this is autoimmune liver. We're going to go into that. Scleroderma, you're 3 to 1. I've seen men with scleroderma. Rheumatoid, I'm not sure about this figure here. Rheumatoid, I see about half and half. I see a lot of men with rheumatoid arthritis as well. And MS, I think I've seen more men than women, but this is saying it's still 2 to 1. You know what MS is? Multiple sclerosis? Okay, that's, again, tissue antibodies, your immune system attacking myelin sheath of nerves, which destroys them, makes them calcify. These numbers are staggering. They're not related to anything but disease. It doesn't include the silent autoimmunity or the autoimmune reactivity. So again, it's vital that we're screening these things.
So if the ratio is so much, it's slightly, go back to the slide, sorry.
Hang on, let me do this. I'm going to use this since nobody's here. And I'm going to put this right here. There we go.
So women are about 30% more likely to have an autoimmune disease. Now all those are the ones where women are more disproportionately affected. So
women will be affected much more than men, period, in this whole thing.
But why is it? It's not that different. 1 out of 12 men, 1 out of 9 women. And yet all those are predominantly women. So which are the ones that affect the men more?
This is very specific to one autoimmune disease. This is specific to all autoimmunity.
Okay.
Does that make sense? So this is just to give you an idea to all autoimmune diseases, and this is specific per the autoimmune disease. So like for Hashimoto's, I've seen maybe one man in my entire
So which are the ones that affect men more than women?
Well,
just I have a self-interest.
The ones that I've seen that affect men more than women are the ones that have to do with autoimmune issues to the testes. Like I've had men show up with testosterone, autoimmunity to testosterone itself, and this only showed up as a reactivity, meaning it was a loss of libido, it was a loss of muscle mass. They had brain fog because of low testosterone in their frontal lobe, and that was something that needed to be taken care of. We had to figure out why they were always having such chronic low testosterone. It wasn't about just giving them testosterone. It was about figuring out the reason why it went low in the first place. As we age, testosterone is going to drop a little bit, just like it does with women, but it shouldn't drop suddenly and with the disease process. That's one. I think I've seen RA with men as much as I have with women. I don't see it 2.5 to 1 ratio. I see it about even. But that specifically is one I know for a fact. I've seen obviously much more men than women because it's not going to happen to women.
Okay, thank you.
Sure. Researchers have identified 80 to 100 different types of autoimmune diseases. That's crazy, isn't it? They're right now just picking tissues and finding antibodies to them, and they know there's an autoimmune relationship to it. They suspect at least 40 additional more. That's much, much more than we actually have diagnosis codes for. They have to put them in syndromes when that happens. So fibromyalgia?
Yeah.
Or chronic fatigue syndromes. Yeah. Okay, we also know that there's an autoimmune relationship to those. So I'm going to go on that a little further later. Physicians in current healthcare systems are not being trained properly to diagnose autoimmune disease, especially in a setting where it's silent or reactive. And I can't tell you how many women come in who are on, say, Synthroid or levothyroid because they've been diagnosed with hypothyroids. And I test the antibodies, and they're actually coming up positive. Nobody ever bothered to do that. Nobody's checking these things. One of the reasons why is because there's nothing to treat. They don't know how to treat these things. The only thing they have are steroids and immune suppressive drugs. So the current healthcare model treats these diseases after it's destroyed enough tissue to make the diagnosis. We just got done saying that. And then it's treated with corticosteroids or immunosuppressive drugs, just like I got done saying as well. This is important because it does not fix the problem. It does nothing to fix the problem. It may dampen some of the symptoms or keep these people from dying, but it doesn't fix anything. And that's why you're here listening to this, because I'm going to tell you how you fix these things as far as the expression of that autoimmunity. Can we cure autoimmune disease? Well, Yeah, we always hope for the best. But
My
yeah,
daughter's doing better with hers.
yeah, that's you can
Treated
do
longer.
you can do better with it, but you don't cure it. You will always have it. But you can change its expression dramatically, and if not changing it and reversing it to where it's gone. Okay, but your immune system will always have that memory of how it attacks its own tissue. And I'm going to go over how you make those changes. So screening, again, the standard medical and alternative testing, that's true, alternative IDS, testing IDS, there's a typo there. They're not always accurate, and they don't find the right tissue level of antibodies. So it's really important to get screened with the right tests. If you're looking at certain medical tests that every average general practitioner is running, they may not be that specific. For instance, if they're only running, say, Sjogren's antibodies, because these people have a lot of pain in their joints and their muscles, they may not be running the whole gamut. They should be running collagen antibodies. They should be running joint tissue antibodies. They should be running muscle antibodies. And that way they're accurately identifying where they should go. Why don't you think they do that?
Because it's a lot of money.
Well, part of it, insurance doesn't cover all those tests. The other part of it is a lot of these doctors don't know those tests are available. I was kind of surprised when I was talking with other medical doctors about this stuff. And they don't know those tests are out there.
That surprised me because if you go on like Quest is one of the biggest laboratories, you can actually type in there, even though anybody can, and it'll tell you what tests you should run for certain things, and they pop up for there. Some of these other tests.
When do you see them run, though? Too?
But I don't. But I'm just saying anybody can do that.
Yeah. It's kind of nice you can do that, huh?
It is. Yeah.
Okay, so treatment has everything to do with modulating the immune system, not suppressing it. You want to modulate, meaning you tame the immune system. I'm going to get into it. I don't think I have slides for this, but I'm going to get into things that are called Th1 helper cell groups and Th2 helper cell groups. And if you're one of those who've been diagnosed with an autoimmune disease, then you know that you have a polarity in that. When we were talking about changing that self-tolerance and immune dysregulation, that's where you have that polarity in that part of your immune system. When you have that polarity, this side tends to flag tissue for destruction, and this side tends to be suppressed. So it's an immune system out of balance. For the rest of the body, there's another part of your immune system that will come back and attack all those flag cells. Does that make sense? Okay. Really need to get a new clicker here. It's getting old. So a few facts here. Most commonly, these are cases that do not respond to medications. So what I get a lot of people in my office that come here, and they've got these things that every doctor's sort of pinballing these people around, right? They come to me and they say, yeah, I'm not responding to my medications. For instance, I had somebody diabetic who came in here. He doesn't respond to any of his medications. That's a clue right there. This could be autoimmunity. Okay? Patients will have a family history. I always check for silent autoimmunity when that's the case. It's a given. There's probably something there. If mom has celiac, we want to check kids for silent celiac, because there's a good chance that's probably going to happen. And usually syndromes or diseases which were previously unknown causes are usually suspect to be autoimmune. For instance, the fibromyalgia, right? And nobody's checking that. Now the Fibromyalgia Society is already talking about cytokine expression, which is great. They're starting to reflect a lot of the information related to autoimmunity. But I see tons and tons of positive antibodies to muscle and fascia tissue with fibromyalgia. Even diseases like Parkinson's and Alzheimer's are now been shown to be a consequence of long-standing autoimmunity. We do autoimmune profiles of the brain. When you see things like alpha-beta tubulins, those are all structural parts of the brain. This is the idea that these, what they refer to as tau plaquing or amyloid plaquing. Anybody a nurse practitioner? No? Anybody? No? Okay. And when they talk about Alzheimer's or any other neurologic degenerative disease, they talk about plaquing. You do an MRI, they see plaquing in certain areas. And you have all the diagnosis and the symptoms for Alzheimer's. You're in stage 1. That plaquing in the brain starts from an immune response. That make sense? So that plaquing now they're identifying that's the cause of Alzheimer's, Parkinson's, is also an autoimmune relationship.
So that could be someone who has like amyloid throughout their whole body, that's started from
Yeah.
autoimmune.
Yeah. Yeah. Any plaque. Because plaquing starts from inflammation. Okay, now, how we modulate this. All the adverse mechanisms, or the things that can cause or lead you to the inflammatory process that would promote autoimmunity, would be excess stress. This is emotional stress. This is a bad relationship. This is a work stress. Somebody who has to fly all over the world for work constantly, never stopping. Somebody who's not getting good sleep. People that overtrain. I see athletes with problems like this because they overtrain. I see a lot of men and women that are, doing things like CrossFit. I love CrossFit, by the way, but I see a lot of overtraining problems with it. Because if you exercise too much, that's just as bad as your brain is exercising too little. Does that make sense? Okay. Drops in blood sugar, hypoglycemia, your blood sugar drops below, say, 80 or 70 or something like that. That contributes to this stimulation. Poor social relationships. If you're out and you're getting in fights all the time, obviously that's going to be very stressful. The emotional stress is really going to be part of the problem here. Emotional stress increases something called IL-6 in the brain. It's an immune inflammatory marker. There's a wonderful study I have over here that I don't have it here. I have it laminated somewhere now, but it shows that IL-6 increases for about 3 hours after a spout with your husband or wife. And they measure this stuff. They have people fight, get into an argument, and they take their blood and measure this stuff. I think it's kind of cool. So they know that kind of emotional stress, though, has a factor in how your immune system is going to behave and how your tissue in your brain will be destroyed. It increases an inflammatory marker called Th17, which is something that has to do with destroying any flagged tissue or amplifying inflammation considerably throughout the body. How many of you have ever been so stressed out the next day you felt sore? Anybody? I've been that way. I take care of myself pretty good. I've been that way. So that happens, and that's real. So now, the beneficial mechanisms: love, appreciation, inspiration. Sometimes when I tell people, when we talk about depression, we talk about reading things that inspire you. Not only that, but we also talk about putting out the fire in their frontal lobe. And that's a real big deal, because inspiration comes from your frontal lobe of your brain. So does appreciation, and love is a lot of areas. So all these things, basically, if you're finding those in life, thank God, this is decreasing your IL-6 and your Th17. It's preserving your brain. A positive attitude, moderate exercise, not heavy exercise, good sleep, social and physical interaction, those sorts of things, getting out in public and talking to people and enjoying, just even saying hello or even giving somebody a hug. They know that stuff on a day-by-day basis helps people function. There's a great research article in the Lancet last September about exercise and positive attitude. They studied these parts of DNA that hold DNA together. And when DNA falls apart, it's because this telomere is taken off. If you picture DNA as like shoelaces, and if the shoelace plastic tip comes off, the shoelace frays, right? Well, it's the same thing like a DNA. And those telomeres, the things that affected them the most, there's no drug, first of all. There's actually no nutritional supplement or botanical that changed them. The best things that changed them were moderate exercise, a raw plant-based diet, and moderate exercise. No, I said that one already, didn't I? Moderate exercise, raw plant-based diet, and there's one other one.
I think you said positive attitude.
Is it positive attitude? Maybe that was it. No, there's something else on there. But it has to do with keeping a good frame of mind, having low stress. Everything that you see here being a benefit here that dampens autoimmunity. It's a great artist. Another one I should have.